everyone, this is Dr. Akash Gupta, aesthetic dermatologist in New Root Skin and Hair Clinic, Kolkata. Today we'll be talking to you about a patient of ours who has undergone hair transplant surgery 3 months ago, and now he's come for a follow-up with his PRP sessions. PRP sessions are very important to have a proper follow-up and have a perfect aesthetic result. So, this patient has undergone his hair transplant surgery 3 months earlier, and now he was complaining of his density. Since he's got a very nice result as of now, he's concerned of little bit of density. In this video, I'll be talking to you about the aftercare of the hair transplant surgery. So first, we'll be cleansing the scalp with betadine solution. So after waiting for about 5 minutes, we'll be starting off with applying the derma roller. The pressure should be very gentle and minimum so that the patient does not feel discomfort or pain. The derma roller should be rolled in 3 different angles: vertically, horizontally, and laterally. Each area of the scalp should be covered so that the derma roller can penetrate in and make different pores. The number of pores the patient is being made, which increases the permeability of the PRP. As you can see, the patient is lying comforted without complaining of any kind of pain or discomfort. Each rolling of the derma roller, which punctures 540 punctures in a single roll. That escalates the permeability and the absorption of the PRP. Now we'll be injecting the PRPs. The PRP contains a lot of growth factors which stimulates and enhances the growth of the grafts. Since the grafts are in the immature phase right now, with the help of the PRP, it advances in their growth and helps in giving the patient a very permanent and beautiful hairs. So are you having any kind of pain?
No.
So as you can see, the patient is not complaining of any kind of pain during the procedure. During this vital time, the patient does not only require PRP but also requires a lot of multivitamins and multinutrients like keratin, vitamin B12, folic acid, and other essential amino acids which help in proper growth and escalates the growth of the immature hair follicles. So the keratin, we give it in supplementations as well as we instruct our patients to take in diet, like foods like eggs, kale, sunflower seeds, mangoes, sweet potatoes, as well as proper supplementation is also required, which gives hair follicles an enhanced growth. So as you can see, in 3 months time, the patient is having this kind of result. So in duration of 6 months, the patient would be having beautiful results with the assistance of PRP as well as supplemental medications. So with the help of PRP as well as supplemental medications as well as the counseling for the diet, the patient can get a desired look, as well as the grafts and the follicles which are immature can get escalated and enhanced to give the patient a very good desired look, which is thick, dense hair follicles. Thank you.